Thanks again for inviting me to give this talk. I thought I would just start by just explaining why why this talk is of interest to me. I think last year I decided on a topic to speak about at our pediatric grand round, and I thought, well, why not climate change? But boy, did I not know anything about climate change, and got really a big wake-up call, as I think we all will. I'm hoping that this talk is a sort of wake-up call to many of you who haven't really been thinking about it much. And even for those who have, I'd like to really reflect on and talk about, the intersection between climate change and health. So kind of as an overview, I'm going to talk about very quickly what is climate change, just to put us in the picture, the effects of climate change. But I think Elise is really the expert here. I'm not an expert in climate change. I'm just a pediatrician like everybody else who's interested in what do we need to know and what do we need to do. And I think Elise will tell us a little bit more about the effects in South Africa, and I'm going to leave it to her as the expert. But I will talk a little bit about it in general because I need to paint the picture of what climate change is and what it does to the, what effects it has, and then it'll become more easily relatable as to how it impacts child health. And then why are children vulnerable? And then perhaps a few examples of areas where we are seeing or beginning to see these impacts that have been theorized but are beginning to be seen. And then I'll end off with what our role is as pediatricians, I think. Okay, so perhaps all of us now are becoming very, very used to these headlines. We're seeing that on a daily basis. In fact, at any one point in time, there's a disaster around the world, a climate disaster, if you like, whether it's wildfires in California, whether it's floods in KZN, whether it's hurricanes in the US, you name it. These things are happening kind of around the globe all the time. Now, whilst any one particular event can't be easily attributable to climate change as such, the general consensus is that the probability that it's related to climate change is very high because of the associations that have been seen over time. This was, last year, as I said, I gave a talk to the pediatricians in our department, or the whole peds department, in about September last year. And at that time, an editorial came out in September last year that appeared simultaneously in 200 medical journals around the world. And it really was a call for action to governments and agencies around the world to really take the whole issue of climate action very seriously and to limit the global increases in temperature. So this was also, there's growing concerns and worries around the increasing, global warming around the world. And I think as healthcare providers, we ought to be joining in on that call. So this was quite a big development. It happened, as I said, simultaneously in 200 journals on the same day. So just quickly, why are we having the planet getting warmer? What is global warming all about? Well, it's got to do with this greenhouse effect. And the greenhouse effect goes like this. You know that our Earth gets heated by the rays of the sun, and a lot of those bounce back into the atmosphere and beyond. But what happens is that we have the greenhouse effect is actually a natural phenomenon, right? That we have some of those rays bouncing back and being kept onto Earth and keeping the Earth warm, because without the greenhouse effect, we would essentially be covered by ice and be almost inhabitable. So to have the greenhouse effect in itself is not the problem. The problem is the acceleration or the exacerbation of greenhouse gas accumulating to the extent that we're getting warmer and warmer. And chief amongst these greenhouse gases, or GHGs, is CO2, okay, carbon dioxide, which is chiefly, there's different sources, but chiefly it's come through the burning of fossil fuels. Now, how do we know that we're getting warmer? Well, there's enough evidence from the time that we've been keeping records in the late 1800s that and look, climate change is a phenomenon that has happened throughout the planet's existence. But what we're seeing is, if you look at this slide here, is that in the last sort of 100 years or so, just over 100 years, looking at pre-industrial period, we have increased our temperatures in an accelerated fashion and have gone up by about 1 degree, and it looks like it is continuing to rise. And this is now incontrovertibly been attributed to anthropogenic factors. Now, what do I mean by anthropogenic? Man-made or man-caused or man-made effects on the CO2 emissions and on the greenhouse gas emissions. So we have not seen warm temperatures like this in more than 2,000 years. Okay, and the last so this should give us cause for pause. Right, this is the slide that should make us very, very concerned. Because what happens to carbon dioxide? As I said, it naturally goes into the atmosphere, but we also have carbon that is sunk in the ground and stays in the ground in different sinks, if you like, for tens of thousands of years in the ground. But we've now started mining this and start burning. We've been burning fossil fuels like coal and oil and gas, and that releases more of the carbon dioxide that goes into the atmosphere. And the concern about that is that actually once that carbon dioxide is in the atmosphere, it actually takes hundreds of years, probably about 1,000 years, before it actually disappears from the atmosphere. So pretty much once you've put it into the atmosphere, it's there forever. And that for me has been the most frightening and most revealing and eye-opening thing about this, about climate change. And in fact, the amount of CO2 that we've already put into the atmosphere has already set in motion the global warming that will continue even if we stop pumping any more CO2 or greenhouse gases into the atmosphere. We are already on a path of increased warming. The question is just how much warming? Are we able to limit it? And the figure that everyone talks about, and we should be all talking about and aiming for, is the 1.5 degrees, not to exceed 1.5. Remember, I said we've already gone up by 1 degree, and we cannot exceed 1.5 degrees. It looks like we are set to and this is by 2100. It looks like we are more than likely to go to 2 degrees or more, which is the most frightening thought, because the feeling from the opinion of the scientists who are spending all the time looking at these things is that once you go to above 1.5, above 2, you actually set into motion a lot of irreversible changes. I mean, it's just unthinkable. This is a climate report that comes from a panel called the Intergovernmental Panel on Climate Change. They issue reports every few years, and they had a big one that came out last year that essentially, confirmed the fact that we are on a path of increased global warming. And despite everything people have done, and in fact we haven't done enough, far from it, we have to wake up, and we have a small window of opportunity to limit warming to these levels of 1.5. So this is what would happen in a nutshell if we don't limit warming. We're going to find that we're going to have heat stress, and I'm going to talk a little bit more about that and how that affects kids. Water scarcity, food security is going to come into play here because of the quality of food production and also the amount and the quality of food. And we're going to have a lot of precipitation, as we're seeing already, flood risks. And this is just part of the problems. There are many more extreme weather events that will happen. In fact, this is how climate change, we believe, is already affecting the globe. Rising maximum temperatures, and we're seeing this on a daily basis. If you look at the weather reports where they're reporting maximum temperatures in countries like Pakistan and India, Europe had it just a couple of 1 or 2 years ago, but we're going to see more and more of this. Even if we stop pumping CO2 into the atmosphere, this is just going to be a continual phenomenon of record breaking. So this is kind of really the bad news. I hope I will give you some good news at the end, but climate change is largely a story where there's a lot of bad news, unfortunately. Rising sea levels, because as the seas get warmer, they increase, the sea level rises, and so coastal regions are affected. There's higher ocean temperatures, and that has implications for sea life, and then in marine life. There's an increase in heavy precipitation, that's heavy rain and storms, and this is happening again, just as much as we're seeing droughts in some parts of the world also related to climate change. We're also seeing heavy downpours and floods. Okay, shrinking glaciers around the world, and thawing permafrost. This is all that's happening right now. We don't have to look too far to see what the effects of climate change. It's come to us. It's believed that the floods we've seen in KZN are also part of this now extreme weather events that we keep talking about. And it has devastating effects that are going to take months, if not years, to recover from, unfortunately. We haven't even started counting the health costs of this. So I looked in preparation for my talk last year, and I felt this was an excellent overview. It's a scoping review of what the evidence is that points towards the impact of climate change on children. What's the evidence? What does it point to? And more importantly, what are the mechanisms or the causal pathways through which climate change actually affects children? Like what should we know, and how does it affect us in pediatrics? So this came out last year in about March. A scoping review, something like a systematic review, except it's not a meta-analysis as such. It looks at all articles. This was a review and not just randomized control, because you can't. How do you do a randomized control trial? It's just not in this context, right? So they looked at almost 3,000 documents through the search. The bottom line is, once they've excluded a whole lot that weren't meeting the criteria of anything to do with an impact of climate change and health, and particularly health that affects children, they came down to about 371 documents. If you look right down at the box at the bottom, 202 original articles. Interestingly, the majority of the articles were from the last 5 years. If you look at the table on the right, you'll see there's been a gradual and now sudden increase in articles pertaining to the impact of climate change on health. So this was done published in 2021, so we only have until 2019 data. So what did it show? So this is the interesting, I think for me, this is the heart of the talk, and this is really where I'd like us to just focus on what the actual interface is between climate change and child health. How does it affect children? What do we need to know? So look, it's starting off at the extreme left, excuse me, we've got greenhouse gases such as CO2, such as sulfur dioxide, many other gases, methane, etc. But CO2, carbon dioxide is chief amongst them, is what's chiefly, as I said, the cause for global warming. And those sources are fossil fuel, but also other anthropogenic activities like deforestation, right? And because we're removing essentially the CO2 absorbers on the planet. Now, with climate change, we are already seeing, as I said, extreme weather events such as hurricanes, floods and storms, altered rainfall patterns, raising temperatures around the world, rising sea levels, as I said, and acidification of oceans, because as you have increasing CO2 in the atmosphere, a lot of that also gets absorbed in the oceans, and then you have rising carbon dioxide levels in the oceans. What does that do? So if you look at this model and this framework, it has either a direct or an indirect impact. The direct impact effects are probably much easier to appreciate, in that once you have a flood or you have a fire, you can see how individuals' lives are immediately, or the health of individuals, including children, are immediately impacted through, mortality or morbidity through injury from those extreme weather events. Just take the event in KwaZulu-Natal where several hundred people died. I'm not sure what the number of children were there that died, but then there's also the direct effects of extreme temperatures as well. So if we look at the direct impact of extreme temperatures, we're going to, and we're already seeing in these heat waves across the world where individuals are small numbers, but increasing as more of these events are happening, where individuals, particularly the elderly, but also children and particularly infants, are vulnerable to heat stroke and heat exhaustion, electrolyte abnormalities, that, as you could imagine, would result from extreme heat in the environment. Droughts and fires, we also have had our share of droughts, and around the world, they say the areas that are wet are going to become wetter and dry areas are going to be dry, and that's just are going to become drier through droughts because of climate change. And that has either a direct impact at the time on mortality in those populations, or more longer term. These direct effects, you might, if you read around this in child health, you'll find that they're also known as the primary causal pathways. And then there's the indirect effects. These are more longer term, and these are also known as the secondary causal pathway effects. So think about what happens now with rising temperatures and humidity in parts of the world, where it actually impacts on the ecosystem, it disrupts the ecosystem and changes the patterns of disease vectors. So like mosquitoes and ticks around the world, I'll talk a little bit about that, as well as the pathogens, such as malaria, such as Lyme disease, such as bacterial infections, fungal infections. All of these are impacted by the ambient temperatures. The other secondary causal pathway effects are an increase in air pollution and rising levels of aeroallergens, okay? So like spores and pollen. That, as you can imagine, has impacts on the respiratory diseases in children like asthma, okay, and exacerbating asthma. And there are studies to show that actually is having an impact on children's episodes of asthma. The other secondary effect that's not actually reflected on this table, but is in the text, is increasing levels of ground level ozone. Now, ozone in the atmosphere is a good thing. It helps protect planet from UV rays, but ozone on the ground, on the other hand, in increasing levels is actually exacerbates asthma. If you look at the increased risk of disease, this is also known as the tertiary effects, and this is the more longer term effects, is that as the impact of climate change affects various geographical regions, you find that it very directly impacts the availability of fresh water and availability, quantity of water, and it also impacts on the nutritional content of agricultural produce. And in some cases, it affects the iron, zinc, and protein content of food. So these are the long-term effects of depleting quality of food. And so long-term, it is estimated we're going to see malnutrition rising as a result of this. It also is leading to migratory patterns of individuals who are particularly indigenous communities living in areas that have been impacted by either droughts or floods. And this is, going to lead to, as we're seeing already, forced migration, people leaving their homes, whether it's Bangladesh or parts of India, and going to higher ground, to places where they are less susceptible. Because unfortunately, climate change, and I'll talk about this later, also affects the most vulnerable populations, indigenous populations. Disproportionately affects them. This is from the American Academy of Pediatrics. It's a similar sort of framework. And if you look at it, you can see that the sort of mechanistic ways in which climate change is impacting children is through either direct mechanism, through extreme weather events and natural disasters, or long-term increased or increased temperatures through heat waves. And we've talked about heat stroke and the impacts of just having higher temperatures, but it also is through the disruption of the ecosystem. I put both frameworks because I think for some people you might relate to this framework a little easier. It's nice to think of it in these frameworks, what are the direct and indirect impacts, and then we can talk a little bit about each of the of these individual ones that they've found to be particularly already impacting child health. So why are children vulnerable? Just very quickly, children are vulnerable, A, because of their physical size. So by unit weight, they are much more exposed to particular toxins whether in water or foodborne or in the air, by body mass, unit size compared to the exposure rate that they have. Then psychologically and cognitively, they're vulnerable because they can't mitigate against the effects of, for example, hot temperatures, heat waves. You can imagine infants and children can't adapt and do things like what we would do as adults when we're faced in such situations. Psychosocially, they are dependent on adults taking care of them, and so they're particularly vulnerable when those adults themselves are also exposed to the same pressures. And then the other thing to consider about children is that they're going to have a lifelong cumulative risk. So some of these risks relate to increased cancer risk because of the UV ray exposure they're going to have, or the toxins exposure they're going to have. This is going to be cumulative over their lifetime compared to adults who have, of course, shorter lifespans. So heat stroke, who are the pediatric populations particularly affected by heat strokes? And from the literature, and again, there's growing evidence, but of where this is happening, and this is happening largely in affecting infants and in adolescent children taking part in sports for a variety of reasons. They do not thermoregulate as well as adults, and so they are particularly exposed to heat stroke and heat exhaustion. Extreme heat is not only affecting children, but also birth or perinatal outcomes. So increased temperatures have affected preterm births, and they're also been considered or thought to be responsible for stillbirths. Here's a meta-analysis done by none other than Matthew Chersick, who's Professor Matthew Chersick is from our School of Public Health and is quite a strong climate change activist and publishes quite widely in this area, and has done work in this area, including in Johannesburg, showing the impact of temperatures even in Johannesburg and preterm deliveries. And I think more work, you'll be seeing more of this in the coming years as he publishes more in this area. So I think this is something that is already having a direct impact. From research, and we know that with increasing temperatures, we're having increased concentration of pollen, and this directly impacts allergies. And we're seeing increasing rates from that scoping review. They've documented studies that are showing increasing rates of allergic conjunctivitis and asthma. What we're also seeing is that with increasing temperatures, there's also longer seasons for some of these plants that result in pollen, such as the ragweed. There are longer numbers of days that they have in the season. So all of this will increase the risk of, or increase the severity, let's say, of allergic illnesses. Talked already about the ozone concentration and how that's related to worsening asthma. So I'm just highlighting a few examples of things that we already have accumulating evidence of the impact. Vector, we said ecosystem disruption will also result in new patterns of disease. So it's postulated that dengue is going to be seen in more parts of the world as temperatures rise. And also the areas where malaria will be seen is also changing already. Several other bacterial and fungal infections are also thought to be going to be rising with increasing temperatures. So this was a climate change and child health inequality review. It was another scoping review, also looking at a number of articles that actually wanted to quantify, if possible, or really look at the evidence base where climate change actually does impact children in lower socioeconomic areas of the world more in a disproportionate way. And because, you often see that quoted. And so in the scoping review, what they found was that there was just, they focused on about 28 then reviews. It was a review of reviews. They looked at 28 reviews very extensively, a search, and they looked very hard for quantitative and good qualitative data that showed that actually disadvantaged or poorer communities, vulnerable populations were more impacted by climate change. And what they found was that although there was agreement across the reviews that children, particularly poor children, and those in low and middle income countries, such as South Africa, are vulnerable to climate change, the state of knowledge and the impact of the climate change and child health, the quality of the evidence was weak, because a lot of these studies were actually just had children as a subpopulation in those studies, and there were not many quantitative studies, unfortunately. So it's a big knowledge gap in it. I'm putting it here because I feel that's kind of our role now, is to get involved in research that actually shows what the impact is on children in low and middle income countries. So quickly, we've just got less than 5 minutes. What should we do as individuals? I should say healthcare individuals or pediatricians. So I think, first of all, we should be alarmed. We should be very aware that climate change is a very real phenomenon, and it's not a remote phenomenon happening in other parts of the world. It's happening around. It's a global phenomenon, and we're all affected, and we're all going to be affected throughout our lifetime, and our kids and our grandkids' life are going to be feeling the effects of climate change. We need to assess our own knowledge and quickly bring ourselves up to speed on what we need to know. It's a vast body of knowledge that's quickly accumulating around the impact of climate change on health. And I'm only scratching the surface, and I'm only just showing you part of what is out there. I think we need to align ourselves as healthcare workers and pediatricians with other healthcare providers and become advocates very strongly. So this is what came out from the American Academy of Pediatrics a couple of years ago, actually in 2015, and it's still what's on their website as their policy statement, which is still very relevant. And I've gone through it, and I think I'd advise everyone to look at their advocacy statement, because it's a very useful resource for us as pediatricians as we think and try and grapple with the problem and try and think about what our role is in terms of climate change. And I like the set of recommendations they've given to us, because it actually, we can take that up and not feel hopeless and not do something about it. Because actually we are in a position of power and privilege as doctors. Society and community look to us to as body of or an authority on, obviously, on children's health. But I think that we have a loud voice, and we should be using it. So we should be promoting climate change in medical education, and I'm hoping this talk is part of my advocacy role in this. I think we should be looking at our guidance that we give to caregivers around mitigation strategies. So for instance, in heat waves, what do we do? How do we get parents to prepare for these things when they happen or before they happen? How do they protect themselves? How do we educate children and families around disaster readiness? I mean, who could have ever predicted what was going to happen in KwaZulu-Natal? No one. But I think we're going to see that with increasing regularity. Sadly, this is the nature of what's the pattern we've seen in other parts of the world. We need to advocate for policies to decrease gas emissions, that's otherwise fossil burning of fossil fuels. And we need to play a much bigger role in arguing why, for example, our own university, Wits University, for instance, should be disinvesting or divesting from fossil fuel, and as many other universities have. And I think something like $42 billion of disinvestment across health institutions around the world is what's been reported. And so we should join that. We should be building broader coalitions. So with other, and there are many other organizations, healthcare organizations, that are actually looking at climate change and putting out policy statements and doing something about it. And I feel we're only just at the beginning. We need to consider how we need to decrease our carbon footprint of our healthcare facilities. I was surprised to learn that 10% of the carbon footprint in the US, for example, comes from healthcare, from hospitals, clinics, and so on. So we are a big contributor as the healthcare industry to the carbon footprint of a country. These are my, just would like to acknowledge Matthew Chersick himself, who shared quite a number of slides and resources. And these are some of my other references. Thank you.